Sexual health, uh, sexual health assessment. So, sexual health assessment simply plays a crucial role in promoting overall well-being and preventing negative health outcomes. Like I have said, it is about assessing an individual's thoughts, practices.
I'm not, so- sorry for interfering. I'm not seeing the screen.
Oh, let me share again.
I think he is not yet share the screen.
Can you see it there? Not yet.
Not
Not
yet,
yet.
sir.
Okay, let me share. There. Are we able to see the screen?
Yeah, yeah, exactly.
Okay.
Say now.
Yes.
Yes. Yes. So I was just saying that assessing sexual health helps to identify the risks, factors, and address concerns and provide appropriate intervention. Just like Thomas said that very many individuals are facing sexual health challenges, including some not being able to be fertile. Assessing a health risk or a sexual health risk helps us, one, to identify the risk, but also helps us in guiding uh, policy, but also finding solutions for such intervention, so that we can use both preventive but also therapeutic methods to solve certain issues that we realize. By focusing on sexual health, public health initiatives can contribute to reducing sexually transmitted infections. Therefore, improving reproductive health and enhancing overall quality of life involves a focus on sexual health assessment. If we're able to do sexual health assessment, we shall be able to come up with interventions that reduce sexually transmitted infections, but also improve reproductive health uh, among our society. Sexual health assessment can be done at individual and population level. Now, individual level refers to gathering information which is comprehensive about an individual's sexual health. Like I had just said about a few minutes ago, it looks at collecting information or data from an individual regarding their behaviors, their concerns, their experiences. And it also now involves that a thorough evaluation on the aspects of an individual's well-being from a definition, meaning their physical, their psychological, and social dimensions. So, away from collecting information and, uh, and having knowledge on an individual's sexual health, behaviors, concerns, and experience, it further goes on to understanding. Uh, you have to evaluate uh, physically, psychologically, and socially. You have to look at those dimensions as part of sexual assessment. So that is at the individual level. However, there is also at the population level, but we're still going through the individual level assessment. Now, it involves, like they've already repeated up there, it also involves uh, understanding an individual's sexual history. For those who are from a clinical background, we often do clinical assessment. And when you get a client or a patient, there are several stages through which you assess an individual. So, likewise, in individual sexual assessment, an individual is taken through understanding what are their sexual histories, what is their sexual practice, Sexual history, you're looking at how someone has lived their sexual life. What is their orientation also? You're looking at sometimes the sexual practices, you're looking at how many sexual partners does this individual have, how regular do they engage in sexual activities. This is now doing an assessment to understand what an individual's history, but also how their thoughts are about their own sexual health. You're also looking at what are the sexual dysfunctions. So it is more of a staged assessment that occurs, so that you're able to understand, or you're able to relate and assess the challenges this individual is going through, but also you're able to realize what key intervention you can offer to such an individual. It may also involve performing physical examination and using screening tools and questionnaires. In most times, in our health facilities, we mostly look at uh, because the highest rate of morbidity in OPD, most times they are not sexually related. One, because we realize that individuals fear to openly interact at an outpatient department. And therefore, we have realized most oftenly that individuals who come for youth related services are the ones who most times are taken through such examinations that include sexually taking their history. But also, we realize it in art clinics. A lot of individuals who come for art clinic most times are undertaken through uh, some of these assessments, possibly because of the stigma associated with sexual illnesses or disorders or dysfunctions that are associated to the different sexual practices people have. Uh, you also need to engage an individual in a non-judgmental communication to understand their own perspective. Like I have just given a brief that most youth have their own perspective of having a particular sexual dysfunction. You may be suffering from an STI, but you may not be able to go openly to the outpatient department to get assist. So you may need privacy, or you may need to non-judgmentally or non-discriminatory communicate with this individual so that you're able to understand their issues. What is the purpose of another purpose for individual sexual assessment? We wish, like I had said just previously, I have been telling you that doing a sexual assessment is not just does not just stop at asking or collecting information or gathering information about an individual. We intend to provide personalized care, but also we intend to identify what are the risk factors. Why, if you've taken history of an individual per se, having in his history for the last 2 days, he has had unprotected sexual intercourse. So you will need to have a risk assessment in that there is possibility of a sexually transmitted illness. There is a possibility of having a pregnancy, which may be unwanted in case the individual wanted to prevent pregnancy. So these are the purposes that we're talking about. And we need to promote the individual's sexual well-being and satisfaction. That is why we do the sexual assessment. Now, what are the skills for conducting a sensitive sexual health assessment? It is sensitive, and we very well know because our community taboos or our social taboos sometimes do not openly allow for discussions on sexual health. So it is quite a sensitive matter in communities. We need to establish a safe and comfortable environment for open communication. In communication, you need to make sure your client feels comfortable, and to establish safe spaces include a space that is private, a place that may not inconvenience an individual or a client. You may not you may start playing music in your session of talking to a sensitive matter like this with a client, and therefore the client will feel that you're not giving him the time or absolute comfort when you're discussing this issue. So we need to take very keen time in establishing a safe and comfortable environment. Now, these are very practical skills, and it is very key that for us who handle sexual reproductive health, but also who handle public health emergencies, including nutrition, it is very key that when you're talking to your clients, you offer them a very safe and comfortable environment. If you're to get information from them, you need to be an active listener, you need to use appropriate language, but you also need to demonstrate empathy and sensitivity. Now, demonstrating empathy does not mean when a client tells you, start to cry. Now, that is sympathy. You're not supposed to be sympathetic. You're supposed to be you're supposed to be empathetic, because in empathy, you're rather strengthening an individual rather than falling for the story that they are telling you. So when you're discussing these issues, you need to be composed and tell them words like all will be well, rather than shedding tears because a client came and told you a very, very sensitive question. Another skill is respecting cultural and individual differences, which we've concurrently discussed in our issues there. Cultural competency involves understanding and respecting diverse cultural beliefs, tailoring assessment and interventions to be culturally appropriate. You need to recognize the influence of culture on an individual's perception, but also you need to be aware of the potential biases and working towards providing equitable care for all individuals. In service delivery, we understand that a lot of our clients get uh, potential biases, especially cultural biases. In many of our African settings, we consider clans and tribes as something very sentimental. Therefore, the bias is always that if this one is not my tribe, then you get biased. And this is very common. However, this is very unethical in service delivery. Uh, we know for the say that in very many African countries, especially the poor African countries, the ones we call developing, there is a lot of this bias, and in the developed world, it is always called racism. So it is very key that when we have cultural competence, meaning that we understand that individuals are affected by their different beliefs, but also that an individual may be seeking or behaving the way they are because of their cultural attachments, then we should be able to be less biased. Actually, we should not be biased at all on cultural basis. And just from this concept of cultural competence, it is very key that we seek consent when we are discussing sensitive topics. Therefore, which we earlier discussed, of course, during menstrual health, it also applies in here in all our aspects of service delivery. more so on sensitive issues, it is very key that we continue to maintain an informed consent and confidentiality. And an informed consent arises from an individual making a decision from an informed point of view. And it is therefore very critical that you explain the purpose of your assessment, what it entails, and ensure that you ask the client or the patient their right or to either refuse or withdraw from this information. So when you're going to do your assessment, you will explain to the individual that my name is so and so. I am conducting this assessment for this purpose. What it entails, it entails asking for your sexual history. It entails some physical assessments. It also entails you writing a few things. Therefore, you ask them whether they are willing, or you also give them the information that if this assessment is done, this is how it can benefit you. If it is not done, this is how it may not. So it is very key that you're able to give them the information that they need. You also need to emphasize that it is confidential, and you will continue to keep confidentiality and protect their information during the discussion. And this is another very key point if you're to dig information out of individuals, especially you need to understand your target group. If you're talking to young children who have their parents, it is very key that you emphasize to them how confidential you will be with their information. Unless you assure them, they may not give you the information that you require. You also need to communicate the limits uh, to confidentiality. You need to tell them that we will need to report certain things in case or they exceed certain limits. For example, an individual who is testing for HIV, whose result you got to be positive, it is only key that you ask them that this information must be or should be disclosed to their partner, because then if it is not, they will continuously infect them. So these are very key issues when we're talking about uh, informed consent. Components of a comprehensive sexual health assessment. From the English word, component would also mean that we're talking about features. What does a comprehensive sexual assessment mean? Physical aspects: assessment of the sexual anatomy, reproductive health, sexual function, and presence of any symptom or discomfort. So when you're doing assessment, you're doing a physical assessment, and physical meaning that these are being seen. So you're able to check someone's sexual anatomy. In other words, you for women, you'll be able to check their reproductive health system, including their vagina, the outside sides of the vagina. For the boys, you'll be able to check around if there are, most times you're checking if there's any discomfort like a swelling, like bleeding, if there's a wound, then you're checking if their sexual functionality is okay. For boys, you're checking if they do have proper erections, like this. So that is the physical aspect of assessing. The psychological aspect involves evaluating an individual's emotional well-being, their body image. You can use body language. You can see how you can assess this individual through their self-esteem. You can also assess these individuals through how they respond to your questions. So then you will be able to understand their psychological aspect. You also assess individuals through the social aspect. What is this person's thought about sex? What are their sexual orientations? How do they identify with gender? What is their relationship status? What behaviors do they have sexually? What does the culture say? Who are their social support networks? Who are their peers? What is their community perception about sexual health? These are very big clues that can help in assessing an individual. So that is the individual part of assessment. I don't know up to that regard if someone has a question. If you have a question, you can raise it now. So before I continue with the population sexual health assessment, if we do not have, let me continue. Population health assessment refers to the systematic examination of sexual health related data and indicators at a broader scale. Here, you're looking at being able to analyze a certain data that has been collected, and you're able to understand, or you're able to look at the trends, behavior, practices of individuals. You may decide to disaggregate it according to different demographic factors. You may want to look at females, you may want to look at the geographical region, you may want to look at age, you may want to look at place of residence. So it aims to gather information on these behaviors, practices, and the outcomes. So it is looking mostly at a defined group, but at large, you can also look at a bigger group of people. Defined meaning that you're either looking at a particular country geographically, or you're looking at a particular gender, like that. That is how defined it is. And that is what we call the population assessment. So it varies, it is different from the individual because you're not necessarily having an interface with one person, but you're doing a general definition. What are the goals of population sexual health assessment? One, epidemiological surveillance. What is epidemiological surveillance? This is a tracking system that helps to identify the disease burden in a society or in the population, and it helps to trace if there are any new incidences on or new prevalence or there's prevalence and distribution of sexual health issues. It monitors the trends and identify areas of concern. Two, another goal is needs assessment, identifying the sexual health needs, priorities, and challenges of a specific population in order to inform the development of a targeted intervention. A healthy disparity identification. It wants to look at and assess what are the disparities in sexual health, and it is trying to disaggregate this according to the age, the gender, the ethnicities. So you want to identify what are the disparities among age groups, what are the disparities among male and female, what are the disparities about according to tribe, what are the disparities according to socioeconomic status. You could be looking at the rich, that. Evaluation of public health programs. That is another reason for population health programs, because we want to understand how effective a program is intervening. It helps us to evaluate and monitor also, so that we are able to guide project. Sexual health assessment is also important in resource allocation. Through information that is gathered and analyzed, policymakers and resource allocation officers can be able to effectively allocate resources according to the challenges that they have identified. What are the common tools and methods of population sexual health assessment? Surveys and questionnaires collect self-reported data on sexual health, behaviors, contraceptive use, and sexually transmitted history. So surveys are looking at a smaller uh, part of the population. Clinical interviews are also another ways or tools that are used in conducting a sexual health assessment. This is where, like I earlier said, that uh, clinicians or health workers are able to ask simple or brief questions on individuals so that they are able to assess an individual's sexual health. Focus groups and qualitative research is also another important thing, especially in conducting qualitative data that wants to look at societal beliefs, attitudes, and experiences. Then people also carry out epidemiological studies, and these are uh, analyzing of population level data. The other day, I was telling you about the demographic health surveys, and if you went to the demographic health study page on your Chrome, you would be able to find data sets, a lot of data sets from the different countries that you want, including our country, South Sudan. You would be able to find data sets that have been collected that you can analyze and understand what are the uh, unplanned pregnancies, what is the STI prevalence, what is the family planning prevalence. You can even be able to understand what is the contraceptive use in your country. You can disaggregate this data by age, by level of education. These are very key studies, and it is very important that as public health experts, you also take interest in analysis and doing research. How do we monitor sexual health indicators? And what are these indicators? Monitoring sexual health indicators helps us track trends and identify disparities and evaluate the effective interventions that are being undertaken by different projects. One, we want to look at STI rates as an indicator. Tracking the incidence and prevalence of sexually transmitted infections in a population is very important. And incidence and prevalence. Incidence in this case meaning new cases of STIs. It is very important for you to monitor uh, new cases of STIs, but also what is the prevalence, the old cases plus the incident plus the new cases, how the society is doing in terms of sexually transmitted infections. And therefore, this is very key in understanding what are the trends and what are the causes. So then you can be able to have interventions. You also want to assess tail. It entails assessing the prevalence, but also what are the types of contraceptives that are being used in the society. So then, if individuals or a certain population, say this tribe, they are highly using IUD, then you're able to deeply understand why could this community be using IUD, or resource individuals who do resource allocation can then be able to understand that we can only distribute more IUDs in this tribe because it seems to be the trend they are taking, whereas we cannot take implants to this society because for them they predominantly use this one. So these are some of the key reasons as to why we use these indicators that you're seeing in here. Also, reproductive health outcomes. We need to monitor the rates of unplanned pregnancies, abortions, and maternal health indicators that include maternal mortality, infant mortality. We also want to look at immunization, EPI. How many of these children get fully vaccinated by age 1, measles, rubella? So it is very critical because at the end, child immunization at a younger age also affects the sexual health of individuals in the later stages of their life. So, having known that from a sexual health introduction, that an individual's sexual health is shaped from childhood, then it is very important that some of these interventions are done at childhood level so that children are able to grow up as being sexually healthy. Key sexual health indicator 4 include sexual violence and consent, which is most times hidden in gender-based violence. It is very important that we collect data on the experience of sexual violence. Whereas many of the biases have been on female, we have also noticed in many of our African society that males or boys have continuously experienced sexual violence. And it is very key that we look at this indicator so that we have interventions into sexual violence and consent. So, if we want to understand what are the experiences of sexual violence in the society, we will also need to understand what are the key causes of sexual violence in the society so that we're able to derive interventions for these causes. Another key indicator is the sexual health knowledge. We would want to evaluate what is the knowledge level. I was just telling you that we want to in population assessment of sexual health, you may want to look at what is the level of education in this society. So societies that are predominantly primary, you may or no education, you may realize that their discussions on sexual health are very different compared to populations that could have gone to either secondary, tertiary education. So this is how critical these sexual health indicators can be assessed in different societies. And having known that an empowered person, a knowledgeable person is an empowered person, it is very critical that we assess the levels of knowledge in our society. What are the national and global sexual health surveillance systems? These are very critical in monitoring sexual health issues. And I was just saying that these systems help us in tracking prevalence and incidence of sexual health challenges. Uh, it also includes having collaborations in surveillance. We need to have collaboration between health departments, research institutions, and community organizations because these are all key stakeholders. We need to collect data on sexual health indicators, and we need to be specific to the region and to the country if we were to achieve a good surveillance. Surveillance meaning being up to date with what occurs in regard to sexual health. We need to inform policy development, resource allocation, and target interventions so that our surveillance system is very, very alert in terms of any, in terms the surveillance realizes there is a sexual health issue, then we need to understand that there is policy, but resources have also been allocated for such interventions. And lastly, on global systems, collaborative efforts by international organizations are being made in issues of trying to build surveillance on sexual health. They are also gathering data from multiple countries. That is how I was saying that they have the demographic health system that is looking at uh, a wide range of data, including sexual health in many countries in the world. So they will give you a global overview of the sexual health trends. And this is also very key. And therefore, these systems need to be strengthened and improved if we are to achieve strides in achieving a healthy population with a healthy sexual health. We need then to organize different webinar or information sharing sessions so that different countries can learn from each other. So let us look at uh, sexual health interventions and programs. Uh, I'm seeing we left with about 17 minutes from the time we started, but I am sure by that time we would have finished. So let us just be a little patient for the next, I think, 27 minutes so that I can quickly summarize. For the remaining, I will just quickly be going through because I understand that many of you could have already understood, or some of the information is what we covered in our other uh, sessions earlier. So let us look at the sexual health interventions and programs. Now, these are initiatives, programs are initiatives, or interventions are initiatives that are designed so that positive sexual health can be realized in our society. And its purpose is to have an improved sexual health of individuals and to prevent or address sexual health issues. These interventions target individuals, communities, or specific populations, and they encompass wide ranges of strategies that include educating people, counseling, but also therapeutic means, which we talked about. What are some of the prevention means or the preventive interventions that are there? Especially on STI prevention, they aim to reduce the risk of sexually transmitted infections, but also contraception helps to reduce the risk of pregnancy so that unintended pregnancies are limited. So some of the interventions include the promotion of condom use and other barrier methods that reduce both the risk of STIs and unintended pregnancy. There is also an intervention of increased access to education about contraceptives so that many people are informed on how they can both reduce STIs but also unplanned pregnancies. There is also regular STI testing and counseling, especially among maternity cases. For example, the World Health Organization now has a policy on testing at first ANC, so that all clients, all pregnant women are tested at their first interaction or visit in ANC. We also do partner notification and contact tracing for STIs. Partner notification in case an individual tests, in case a mother tests positive during the antenatal care visit, we're required to do partner notification as an intervention means so that the individual who is positive does not keep quiet and continuously infect their partner. We also do tracing so that we're able to understand how many partners this person should have risked with in case of multiple sexual contact. Targeted interventions for high-risk populations are also there, especially for the sex workers and also men in uniform. Comprehensive sexual education programs are occurring as a preventive measure, educating communities about reproductive anatomy, contraceptives, and STIs, also addressing gender equality, diversity, and LGBTQ inclusivity as prevention methods, emphasizing the importance of mutual respect, consent, and sexual rights, also encouraging responsible decision making and critical thinking. Sexual violence prevention and support services, which aim to reduce the incidence of sexual violence. And this includes both legal and social support. Many of the victims have been offered social support, but also legal support. However, there are also interventions that have gone ahead to help prevent sexual violence, especially through counseling and reinstating psychological issues that are leading to sexual violence. The key activities include educating on consent, bystander intervention, and healthy relationships. Now, these are key activities we're looking at if we are to reduce issues of sexual violence. We need to educate people on consent, but also we need to educate people around these people so that they can intervene. And then we need to promote healthy relationships, free and relationships that are based on truth. Training for healthcare professionals, educators, and community members on recognizing and responding to sexual violence is very key in reducing sexual based violence. Support services that include crisis hotlines through phone calls, counseling, and advocacy for survivors, which also include helping survivors to be reinstated in the community so that they are free of violence, but also stigma and discrimination. We also need to collaborate with law enforcement and legal systems in order to ensure justice for these survivors. These are very key interventions that we can have towards reducing sexual violence. LGBTQ inclusivity in the healthcare. As we discussed earlier, it is very important that we offer services free of discrimination. So it is a very important component that we offer services to our society free or regardless of their sexual orientation or their tribal sentiments. Key components for LGBTQ: culturally competent healthcare services that are sensitive to the needs of LGBTQ individuals. Uh, we need accessible sexual health information and resources tailored to these communities. We may be having minority of these communities in our societies, so it is very key that we support them in accessing healthcare so that we're able to intervene before they cause a sexual health uh, issues in our society. Access to sexual reproductive health services is very key now. Ensuring access to comprehensive sexual and reproductive health is very vital in promoting sexual health. And the key components of access to, we are looking at how individuals or how easy it is for individuals to get sexual reproductive health services. Now, it is very key for us to understand the component or the packages of sexual reproductive health services. We might be talking about sexual reproductive health services when majority of us do not know what the package is. And therefore, it is very critical for you to understand that this includes maternal health services, these include child health services, these include HIV testing and counseling services, these include STI testing and management. We also include menstrual hygiene as key components of sexual reproductive health. There is also adolescent and youth counseling. These are very key aspects when we're talking about sexual reproductive health services. So you shouldn't be confused when we're talking about sexual reproductive health. Availability and affordability of these services is very key in access. So reproductive health services, for us to ensure accessibility, we need to see that they are available and affordable, and they are also quality. So we also need to ensure there is access to contraceptives, family planning, and pre or postnatal care. These are all components of sexual reproductive health. So these components of sexually transmitted infection testing, treatment and counseling services, safe and legal access to abortions where the law permits. Unfortunately, in many of our countries, this is not there, including Uganda. Abortion is illegal. So most times you cannot be able to access abortion services in government facilities. However, they have advocated for after abortion services. So most times they are disguised as abortions due to other causes, and these people are given some assistance. Confidentiality and non-judgmental to facilitate help-seeking behaviors is very critical in ensuring access to sexual reproductive health. We very know our community has already a very poor health-seeking behavior, and if we continue with our very judgmental or sentimental issues when we're offering sexual reproductive health issues services, then it will be very hard for our community to access sexual reproductive health issues. Access to sexual reproductive health issues continuously, they are all those points that I have discussed are highlighted furthermore here. Addressing the inequalities in sexual health. The health disparities refer to the differences in health outcome between the different groups of the population. Vulnerable and marginalized populations often face increased sexual health risks, and our majority of our society has a lot of vulnerable people. What are the key steps in addressing the inequalities? The inequalities, most of the minority groups, including LGBTQ, youth, disabled persons living with HIV, then individuals who are displaced, especially our refugees who are in the camps. These are now risky populations that are having health disparities because of the differences in access to health interventions. So, how can we address some of these issues? We need to identify populations that are high risk, which include youth, minorities, individuals with disability, just as I have said, and homelessness. We need to also understand their specific challenges, which may be stigma, discrimination, limited education, limited access to healthcare, but also it may be as a result of economic challenges. We now need to engage with the community, organizations, and advocate so that our policy is informed and program development is targeted to our societies that are at a higher risk and at a disadvantage. We also need to improve access to sexual health information through education and resource allocation to communities that are underserved. Reducing the barriers to healthcare, including financial barriers, transportation issues. So we need to also economically empower these communities, but also we need to work on our referral systems so that our transportation issues are easily solved. Cultural or language barriers might be another challenge, and it is very critical that we understand that these issues should be solved. Uh, Enhancing cultural competency, which we discussed about, meaning that as a health provider, you should be able to understand that an individual's sexual behaviors are directly being influenced by their cultural belonging, and that cultural behaviors or cultural norms vary accordingly. As a health worker, when you understand these differences, you will be culturally competent and you'll be able to offer service to individuals, thus addressing the disparity. Tailoring interventions to marginalized community, as we earlier said, and these further elaborated in here. So, for us to promote health equity, in that in equity we are meaning individuals have a fair and just opportunity to achieve optimal sexual health. We need to ensure equity in the distribution of resources and facilities across different communities. We also need to implement policies that promote and protect sexual rights of all individuals. Advocating for policies that address social determination of sexual health, such as poverty, discrimination, lack of education, are very key in intervening and achieving health equity. Engaging in community-based participatory approaches to involve communities in designing and delivering health services, so that in any intervention, when you do participatory research, you're able to get projects from individuals so that they can own these interventions. And lastly, we would want to look at the legislative frameworks for sexual health as an intervention to achieving sexual health equity. These legislative frameworks play a very crucial role in shaping sexual health policy and practice, because they help in directing resource allocation, but also these laws promote sexual rights. They promote non-discrimination. They ensure access to sexual reproductive health services. So these legislations that address issues regarding consent and sexual violence are very critical if we are to intervene. Policies that support comprehensive sexual education and sexually transmitted infection prevention programs are very critical in achieving sexual health equity. Regulations related to access to contraception, abortion services, and HIV prevention and treatment are very key. And these regulations should mean that individuals can freely and affordably afford these sexual health interventions. That brings me to the end of our module for for sexual health. Unless we have any questions, that is where I can end. Unless we have any other questions. Do we have any questions? It has been a wrap. Eh? I don't know if we have any questions. Yes, sir, Rose.
Yeah, thank you for giving me the opportunity. I would just want to know something more about the pathophysiology of the sexual dysfunction both in male and
The
in
what?
female. Pathophysiology of sexual dysfunctions in male and female.
Yeah, okay. Any other question before I can answer?